What is up, YouTube? It is Coach Kolton here to bring you physique development tools, skills, and opinions that hopefully you can use for yourself to make some gains. I think it's pretty apparent that in the news as of late, we've had a lot of bodybuilding deaths and traumatic experiences, and a lot stemming from kidney issues, we'll call them, whether that's all the way to stage 5 kidney failure, rest in peace Boston Lloyd, to just the preemptive stages of kidney failure in general. This is chronic amongst the bodybuilding community for many, many reasons, most of which are blamed on things like high blood pressure, which is accurate, high levels of blood glucose and serum insulin levels, which is also accurate, and then also having thicker blood or a high hematocrit can also cause a lot of issues there. But there's a lot of interesting things that people aren't considering when they're considering kidney issues, especially in the female community. So there's a study here I wanted to pull up and show everyone and just kind of elucidate a little bit. Thyroid hormone increases oxygen metabolism, causing internal tissue hypoxia, a pathway to kidney disease. Now, this is a great detailed study. It is an awesome way to kind of understand the complex mechanism behind thyroid hormone, how it increases oxygen metabolism, and in that sense can damage the kidney. So there's a lot here, but basically what I wanted to just kind of summarize is this topic itself. The proposed mechanism of the development of neuropathy are many, complex and often overlapping. Although recent literature strongly supports the role of kidney hypoxia as an independent pathway for nephropathy, the evidence remains inconclusive since the role of hypoxia is difficult to differentiate from confounding factors such as hyperglycemia, which I had mentioned, hypertension, and oxidative stress. By increasing kidney oxygen consumption using T3, thus avoiding these confounding factors, the aim of the present study was to investigate renal hypoxia per se as a casual pathway for the development nephropathy. Basically, rats were treated with T3 at about 10 micrograms per kilogram a day. So that's actually a pretty significant dose. And the angiotensin II receptor agonist with 1 milligram per kilogram in drinking water to eliminate the effects of T3 induced renin release, so just avoiding an increased blood pressure, and compared the rats to a control group. And after 7 weeks, they found that kidney function, oxygen metabolism, and mitochondria function were elevated, and T3 did not actually directly affect the glomerular filtration rate. However, the increased oxygen consumption did result in cortical hypoxia. So the nephropathy demonstrated in the rats was developed from T3 usage, which wasn't directly what caused the kidney issues, but it increased oxygen consumption, which led to those specific issues. Now, the problem here is that when bodybuilders are entering a prep or they're trying to lose body fat, and even some sneakily use it in the off season to by way of improving how much food they can consume while staying lean, or using it on and this is not unheard of, using it on a cheat meal to maybe void out that cheat meal's effect on their fat accrual. So this is not unheard of to use short-term doses of high amounts of T3, or just a generic prescription from a coach of 25 micrograms of T3 every single day. This is not unheard of. And for some people, 25 micrograms may be astronomically high for what they need. And so when you're looking at this and you're seeing another pathway in which kidney disease can be procured in any old individual, and while T3 seems like some sort of innocuous compound, I think it's actually rather pernicious when you consider its effects on heart rates, blood pressure, and now oxygen consumption, which will, in the end, cause some form of kidney maladaptation. So, as a bodybuilder, when you're interpreting data like this, it's really important to consider all the variables. What are you doing right now that's taxing your kidney, that's taxing your brain, that's taxing your heart, your liver. And I would argue it's a lot of what we do. Any androgenic anabolic steroid is going to impact the angiotensin pathway, which will impact blood pressure. It's going to impact any androgenic anabolic steroid is going to impact hematocrit, increasing that process, and also, increase iron consumption via meat is going to oxidize and create more oxidative stress, which honestly, at the end of the day, kidneys are one of the most jeopardized organs in a bodybuilder. And so what I really recommend people doing is, if you're going into a prep, there's naturals who get to the leanest condition you could ever imagine. I mean, grainier than any IFBB pro I've seen get. And they do this just by fucking hard work. It's a surprise, right? They just do cardio and they cut calories. I did it. That's how I won my pro card. It sucks, but it works, right? And we need to stop leveraging, T3, clenbuterol, all these different things excessively if we don't really need to, right? And this is the problem, is like I just watched a thing from John Jewett, who's an awesome educator, but he even says, like, when I'm feeling fatigue, I'm going to throw in some clenbuterol and combine that with tren, because tren is going to increase the adrenergic receptors and thus will lead to kind of this super compensated fat loss state. And I'm like, you're feeling fatigue, and adding more cardio would cause more fatigue, but you're willing to jeopardize things like renal and hepatic health in the end just for a short-term attenuation of that fatigue. And I can't really get behind that. I'm always much more of the approach as low as you can go for as long as you can go. I'll go through 8 weeks of a prep on TRT, and then the last 8 to 10 weeks I'll be like, okay, well, we're going to slowly incrementally increase dosage to something that wouldn't be feasible by most pros out there. So like, I get that bodybuilding is a very much independently it's a genetically ran sport. Like, if you don't genuinely have the genetics to sustain health detriments and improve your physique rapidly in a short time frame, because you don't want to be extendedly or having a chronic and extended use of compounds such as, for example, T3 or any androgenic anabolic steroid, you're not going to win. So I'm not going to push those boundaries as maybe someone else would, because quite frankly, I see data like this all day long, and it's like, why would I jeopardize something in which there's going to be a lot of issues in? So just a food for thought, I guess, and take it as you will, right? Some people aren't going to find this useful, but I think this information is wildly useful, and I wish I would have known it, last prep I did or 2 preps ago. I wish, people I know would have known this information, who are now suffering from acute kidney disease because of not paying attention to things like this, or checking their blood pressure every day and stuff like this. So that is really it. If you guys enjoyed this video, please like, comment, subscribe, and let me know what you'd like to see more of.